I have no training in human nutrition. But what I realize, if you put something in your mouth and you like it, spit it out. It's unhealthy. So that is my point of view. And now we will look at some of these unhealthy stuff and the heart. So that is what I want to sort of discuss with you. The first issue is that if we talk cardiovascular prevention, this is a lifelong effort. There isn't a period that you can do it and then you can relax. Even old people, even older than me, even older than 80 years, will benefit from some other prevention. And we have very good trial data on smoking, blood pressure. There's even one trial on diet as well. But to me, what is much more fundamental is that you can get an increased cardiovascular risk in childhood, even before birth, which may influence lifetime cardiovascular risk. The most dangerous organ in the body is a uterus. Because if there's something in the uterus, the mother must be very careful, because you are going to influence that child's lifetime cardiovascular risk. Then you give this unhealthy child, and he's now 45, and I see him for the first time. There's very little I can do. I wanted to see him 45 years earlier. So this is the issue about lifelong prevention of. Now, from our point of view, from a medical point of view, central to the development of cardiac disease is LDL cholesterol. We know, and I just took certain things. I took the Mr. Fit data, which is done on more than 300,000 people, followed so far for 35 years. And it shows that if your cholesterol is between 3 and 4, there will be about 7.7 deaths per 10,000 patient years. But if your cholesterol goes up to 8, there's now 54.5 deaths per 10,000 patient years. So there's no doubt that there is a correlation between cardiovascular death and LDL cholesterol. Therefore, another reason is, what about monogenic raised LDL? You all know about homozygote familial hypercholesterolemia. They all die before they're 10 or 11 years old because of this very high LDL. Then, of course, the PCSK9 gene loss of function mutation, you have a lifelong LDL. Therefore, your risk for coronary heart disease is reduced by 88%. And that's about 2% of the population will have this gene mutation. And that's evidence that you cannot have too low an LDL level. What we don't know is what is that safe LDL level. These people's LDL levels are frequently below 1. And you know that we consider a normal LDL 3 millimoles per liter. Then, of course, if we reduce LDL by independent means, it reduces cardiovascular events. The nice one is the statin one. We all know that if you reduce LDL by taking a statin, you can reduce the relative risk up to 35%. Surgery, an ileal bypass, the old POSH trial, also where you have reduced LDL, there's a reduced cardiovascular events. So this fulfills the classical criteria of causality. So until we get something else, this is what we are focusing on as medical doctors. Then, the problem, and I must share it with you, despite reducing LDL, especially with statins, there remains a considerable residual risk with many people experiencing another cardiovascular event. And now that is where we are looking at various other things. What can we add to statins to reduce cardiovascular risk? And of course, blood pressure and smoking and all that comes in there. But in my view, from internal medicine, there's this blossoming and interest in the role of a healthy diet. Would that be the answer to reduce this cardiovascular residual risk. And that is the new era we're sort of moving into. Now, if we go back to 2002, using one of the medical journals, the JAMA, it says that the optimal diet for prevention of coronary heart disease is to use non-hydrogenated, unsaturated fat in place of saturated fat and trans fat. Now, I remember, and I think I still remember, if it's nice, there's a trans fat in it somewhere, spit it out. So the problem is that we did not know about this. Increase of omega-3 fatty acids from fish and plants, increased fruits, vegetables, nuts, whole grains, and reduced refined carbohydrates. That is what we teach our medical students. This is what we as doctors believe. And I don't think that we've made much more progress than this. And I'll go a little bit through a few of these things. So, this I regard as of fundamental importance in human nutrition. It's this meta-analysis in the Archives of Internal Medicine 2009, Mente, which looked at 146 prospective cohorts and 43 randomized controlled trials with more than 500,000 people over a span of 11 years. And it is the first, and as far as I know, the only systematic review that used the Bradford-Hill guide for the assessment of causality. Now, there was strong evidence of causality that a Mediterranean type of diet is protective of coronary heart disease. The hazard ratio 0.64, in other words, the relative risk reduction 36%, which is, if you think about it, the same as a statin. Now, there's also strong evidence of causality of a harmful effect of trans fatty acids and high glycemic index food and a Western type of diet. Read refined carbohydrate and read nice taste. So that is what we know. There was moderate evidence of causality that fiber could be protective and omega-3. But, and this was the controversy that started, there was weak evidence of causality that total fat had anything to do with coronary heart disease. Neither saturated fat, neither meat, neither eggs, neither milk. They didn't protect, they didn't harm. And that, of course, given the restriction of prospective trials, of course, have led to almost an unbridled sort of new gospel that started to run through South Africa, that you should eat as much fat as possible, and which is also probably based on this. So this is where we started. So we start fresh from 2009, because that is the data we have. So most of the, I'm not going to talk about the question of vegetables. Hell, we finished with that. You must have 5 veggies, or 7 veggies, or 8 veggies a day. Whether they're green, yellow, or pink doesn't matter. That's not the issue. The issue is to eat the stuff. So we're not going to talk about that. So this is just my opinion. Now, if we go back to the American Journal of Clinical Nutrition of this year, and we look at the EPIC study, there are many publications on the EPIC study, but look what they did. This is from 9 European countries plus the UK, more than 300,000 patients over 12 years. They looked at the number of health metrics. A normal BMI, exercise, just walking 30 minutes a day. You don't really need carbohydrates for that. Limit energy-dense food, limit sugary drinks. I mean, especially in children, but anyway. Eat plant foods, at least 5 servings of a variety. Limit starchy food. Limit animal food to at least 500 grams of meat per week. Limit processed meat. I would say abolish processed meat. Limit alcohol. That shouldn't be less, to be 2 for men. And then they added breastfeeding as a health metrics as well. What I want to show you is totally unexpected. What was totally unexpected is that total mortality was reduced by 34%. That is not unexpected. But look here, what was unexpected? The hazard ratio for respiratory death was reduced by 50%. Respiratory death. So a healthy diet does not only have an effect on total mortality or cardiovascular mortality, but respiratory death. Cardiovascular death significantly reduced, and cancer death. Because the problem with diets is that if you reduce one risk, you may awaken another risk. And we have to have this balance between the heart, the brain, cancer, and degeneration. So if I have too much of one thing, I start to forget people's names. Fortunately, I haven't forgotten my own name, so there is something that I'm doing right. So another issue that started was suddenly people started to question the role of saturated fat. And this was based on this meta-analysis of Siri Tarino, 21 studies, more than 300,000. Look at the hazard ratio, 1, and it went from 0.89 to 1.11. So it means, if you look at it, saturated fat has got nothing to do with death or cardiovascular disease. That's what it says. Therefore, you can take as much fat as you want. Then there was another this was, of course, I think it was the first time they looked at it, but they didn't look properly. So if you now go back to the multi-ethnic study, they showed that dairy is protective, relative risk reduction is 21%. Meat could be protective. Another meta-analysis showed processed meat to increase mortality by 42%. Another meta-analysis, dairy, saturated fat reduction. So the whole question, as I understand it, there's a question. Would it be the source of saturated fat that is important, rather than the total amount? I cannot for one moment imagine that if you buy biltong or a steak or a chop with a 4-inch piece of fat, that it's healthy if you eat it. I mean, it goes against the grain of medicine. But if you eat lots of virgin, extra virgin olive oil, that may be different. And I'll end with a trial on that. So the next thing is, would it also the cardiovascular risk be influenced by which nutrient replaces saturated fat? So if I cut off the fat from my chop, that energy, what would I replace it so I can feel that I'm satisfied? So if we replace, just a few trials, saturated fat by PUFA, what a nice name, for polyunsaturated fatty acids. If you look at this meta-analysis, published already in 2010, relative risk reduction of cardiovascular disease, 19%, but no influence on mortality. At least there was no increase in mortality. There was no increase in cardiovascular disease. Another one showed, another meta-analysis by a different author, relative risk reduction of 13. If you replace the saturated fat with trans fatty acid, you increase the risk of cardiovascular disease. So I think we have all been convinced on trans fatty acids that that's not a good replacement. If you replace the saturated fat with refined carbohydrates, high GI, there's a relative risk increase of cardiovascular disease, myocardial infarction, of 33%. So if you replace it with a low GI, there's a risk reduction of 12%. So it's the type of fat that could be important. And if you replace it, it depends on with what do you replace it. And the problem with trans fatty acids, as I understand it, it gives taste to low carbohydrate food. Therefore, if you put it in your mouth and you like it, spit it out until you've read what is on the package. This is my idea. So, then there's a Cochrane meta-analysis, you all know about it, and dietary fat. So, where they looked at reducing saturated fat and or modifying it. Relative risk reduction, 14%. There were 24 comparisons, 65,000 patients. The only problem that bothers me with this meta-analysis is the I-square of 50%. Means there was lots of heterogeneity. So they say that subgroup analysis out of that says that the benefit is in fat modification, not fat reduction. And that's why we go back to the 2010 Torino meta-analysis. So all studies suggest to me a new concept. And that is that total fat is not important, but the modification of the source of fat is important in reducing cardiovascular disease. So if you want a chop with a big piece of fat, cut off the fat and take a swallow of virgin olive oil. That will probably serve. I know I'm going to get lots of criticism, but that's how I understand it. And I've got no training in human nutrition. So now we get to this low carbohydrate, high protein issue. If we look at, and the argument that people are using is this argument. Original humans were hunter-gatherers. So the only thing they could eat was lean game meat. And lean game meat has got high concentrations of PUFA. Then, as humans developed, they started to go into agriculture. So now suddenly there was grains, and they switched the game for farm animals with saturated fat. And the next stage was westernized man. Now, my view of westernized man is a Mercedes-Benz. You drive, you stop next to a little thing, you talk into this thing, you say, I want 2 and 3 of this with this and this. Then you drive around the corner, you pay, and you get a package of instant food. That's very nice tasting. And it says lots of refined carbohydrates, and we add sugar to everything. And the argument now, it says we should go back to primitive man in terms of diet. Which, okay, in 1825, this French person said, if you want to eat, don't eat anything that contains starch or flour. So this was the beginning, I think, of the low carbohydrate diet, which was many years ago. Now, if we look at the global burden of disease mortality prediction, there's generally predicted a rise in cardiovascular disease, obesity, the metabolic syndrome, and type 2 diabetes mellitus. And many people are saying this is the penalty that the globe is paying for the increased consumption of refined carbohydrates and sugar. So it's when we switched, this is the disease. Now, go back to the Second World War, when many of you were born. There was not a single case in Holland of type 2 diabetes mellitus. Not a single case. Because there was famine just after the war. And 10 years later, there was almost 10% of the population had diabetes. So the problem is, if you put it in your mouth and it tastes nice, spit it out, read the package before you decide to put it back again. So this is the issue. That's I understand it. Then, what about the effect of low carbohydrate, high protein on risk factors, cardiovascular risk factors? And we have a meta-analysis of many trials on especially obese patients, shows significant weight reduction, reduction of blood pressure, triglycerides, fasting glucose, increase in HDL. If you compare the same low fat versus low carbohydrate, they're equally effective. But low carb reduces triglycerides more and increase HDL more. So that we have another option, and that is a low carbohydrate. in terms of reducing cardiovascular risk. Not only a low fat. And it's not the fat, it's the content of the fat, not the total amount. Then let's look at this very popular low carbohydrate, high protein diet. Because if you go on it, you melt all the kilos away. Nah, what a wonderful thing. Everyone looks the opposite of me. But we are not 100% sure about the long-term effects of this. So let's look at mortality data. We start with Halton, which looked at more than 82,000 patients. Hazard ratio 0.94 goes from 0.76 to 1.18. In other words, it says no effect on mortality. But if you carefully look at it, you can see that for animal fat, there's no response. But for vegetable fat, you can actually reduce mortality if you use animal fat in your high protein thing. Hazard ratio for a high GI, 90% risk increase. This one, with a very funny surname, showed no risk except if you're an older woman. You have a relative risk increase of mortality of 21%. So this is not for the elderly. This is for young ladies who wants to lose weight. But I'm not sure what the age restriction is. But older women, and I'm never there to say what is an older woman, should not go on this diet purely for the sake of losing weight, unless you've had a proper, decent medical examination, and especially renal function. Then, if we look at the Greek study, they showed a relative risk increase of mortality on low-carb, high-protein diet of 22%. Fung showed an increase of 12%. Animal protein goes from anything between 12 and 23%. So this combination on the long term, we do not have consistent evidence that it's beneficial. In fact, we have indications that it may be not to the benefit of people over the long term. If we look at the hazard ratio for vegetable protein, there's a relative risk reduction of 20. So once again, it depends on what you consider your protein that you're taking. Sjegren showed no risk. Another one from this, relative risk increase of 5%. So until we have more data in long term, this is probably a good diet for a few months to show someone that you can really lose weight. But there's health hazards to this. Now there's also a big health hazard with low carbohydrate. And I discovered this a month ago. And that is the healthy gut theory. The gut, to have a normal microflora, need a certain carbohydrate load. So you cannot exclude carbohydrates from your diet. Then you will get cancer. You may also, when you go into an high care unit or an intensive care unit, you will get an infection, septicemia, so that you may end up with a stool transplant in high care unit, which is where we are at the moment. So the carbohydrate message since 2011 was restrict refined carbohydrates, especially for the metabolic syndrome. We have no doubt about that. Replace it with a PUFA or a healthy source of protein like plant or dairy. Use whole grain. So this is the whole issue. If you now go on a low carbohydrate, high protein diet, what do you do after about a year? With what do you replace it? And I could find no good evidence in the medical literature. So everyone says after a year. Now you can imagine how hard work it is to go on a high protein, low carb diet. You have to sustain it. No chocolate, no ice cream, no cookie, no nothing. So this is not a sustainable issue. So what about red meat? Now, I've just read this new article in JAMA Internal Medicine that came out last week, 2 weeks ago, that shows it's now being confirmed in very large prospective studies. You will develop type 2 diabetes if you eat too much red meat. But let's look at the health professions study and the nurses' health, more than 120,000 people over 20 years. The culprit is unprocessed meat. Mortality increased by 13%. Cancer mortality 10% for in general, and for processed meat 20%. So once again, that implies no salami, no hot dogs, no bacon, no nothing. We don't do that. I must confess again, I had a whole grain sandwich that I brought from home for lunch, and I washed it down with a Lindt chocolate. I couldn't contain myself, so that is the problem. So, another meta-analysis of 20 studies with 1.2 million people. Red meat, 100 grams per day. There's no significant effect on coronary heart disease. But if you add 50 grams per day of processed meat, there's a relative risk increase of 42%. So this is where we are with the issue of red meat. So if you buy beef, it must be good quality beef. And the moment it's processed, give it to your neighbor. So, what about the coronary heart disease diet? We all know fruit, vegetables, nuts, whole grain, fish. Relative risk reduction 19 to 30%. Unprocessed meat has got no significant effect on coronary heart disease, positive or negative, but it will increase mortality. Processed meat will harm you. So don't eat processed meat. You can have your egg, very good. You all know egg is a good thing. Not more than 25 a week. For the simple reason you can't afford it. There's no other reason. So the point is that we had a little bit of a shaking up of our concept of what is good for the heart. Because previously, everything about diet was the prevention of cancer. And now we have much more issues. So I want to end with this fantastic trial, because it fulfills all my criteria of a proper randomized controlled trial. So let's look at it. Published in the New England Journal of Medicine 2013. They took randomized control, a high cardiovascular risk by people with at least 3 risk factors. Just to remind you, the cardiovascular risk factors: smoking, high blood pressure, cholesterol, sugar, etc. And type 2 diabetes, already a cardiovascular disease. 7,000 of them over 4.8 years. The primary endpoint was a composite of cardiovascular death, myocardial infarction, and stroke. Why that one? Because now you can compare it to drugs, because since 2000, we've used that primary endpoint for drug therapy in cardiovascular disease. And what they did is they put everyone on a Mediterranean diet. Now you can argue about the components of the Mediterranean diet, but take it, go and read the article, Mediterranean diet. To that they added 3 groups, randomized. Extra virgin oil, up to 1 liter per week. Nuts, as many as you could stomach. Or placebo. Now look at the event rate. There was 96 events, death, MI, stroke, out of 2,400 on olive oil, which is 3.8%, versus 109 over 2,450, which is 4.4% on the Mediterranean diet. So if you look at the hazard ratio of this, it's a relative risk reduction of 30% on top of a Mediterranean diet by swallowing an couple of extra virgin olive oil. Now, what I went further is to work out the event rates, because I want to know what is the treatment effect size. which you can't do in a prospective study. So look here. The olive oil will 8 out of 1,000 patient years. That means 1,000 patients that swallows extra virgin oil for 1 year, 8 will get either death, MI, or a stroke. But if you just use the Mediterranean diet, 11 will. So by swallowing virgin olive oil, you will save 3 patients' lives out of every 1,000 you treat. That is almost the same as the beta blocker data in cardiovascular disease. So what I want to show you, why I showed you this, is that for the first time, I have this idea that if my drug therapy, I should add an intense, healthy diet sort of issue, because I am now convinced that the effect size of treatment is the same as drugs. What I don't know, except the on-target trial, is if you add the diet to the drugs, what would be the effect? Now, you can go and look up the on-target trial, but it wasn't well done. So, in conclusion, what I wanted to show you is that there are new role players. Everything I've said could come to nothing. The new role players, if we talk about a sustainable diet, we have to look on the production of this specific food pattern, the effect on the environment, which is the big topic in your literature. The next one is genetics and the role of epigenetics. But the big one that makes me so enthusiastic about medicine is the interaction of the host, diet, and gut microbes in terms of disease. We now know it's a significant pathogenic mechanism for obesity and the metabolic syndrome. In the New England Journal of Medicine not long ago, is now involved in atherosclerosis. A simple experiment. They looked at dietary choline from eggs, beef and liver. It's changed by a certain group of gut microbes to trimethylamine, which is absorbed in the bloodstream, changed in the liver to trimethylamine N oxide, which promotes the formation of foam cells from macrophages. And that is the beginning of atherosclerosis. So, to prevent or to promote a diet without you looking at the effect on the gut microbes would be a fatal mistake. And with that, I say thank you for your attention.